Test 1 2 3. Test 1 2 3.
Alright, ladies and gentlemen, don't forget to record your session and then you may start once you are ready.
Assalamualaikum warahmatullahi wabarakatuh and good afternoon to all participants. Thank you for joining our webinar today. My name is Nur Asma MYSARA binti Muhammad ROSNI and I will be moderating this webinar. Honorable Madam Christina Binti Abdurazak as a lecturer English proficiency for Group AI, respectable to our participant today. The theme of our webinar is health, and today our webinar will discuss about living with COVID-19. Ladies and gentlemen, our first panel today is Mr. Aerron ANAK as a freelance health and technology speaker who is responsible to give information to the public about our health. The next panel is Mrs. NADIA MYSARAH BINTI ZULKARNAIN as a senior public health physician. And the last panel on this webinar is Madam JESSILIANA ANAK BIBIEN as a public health officer. Before I give the first question to our panel, I would like to share with you about COVID-19. So, what is COVID-19? COVID-19 is a disease caused by a virus named SARS-CoV-2 and was discovered in December 2019 in Wuhan, China. It is very contagious and has quickly spread around the world. COVID-19 most often causes respiratory symptoms that can feel much like a cold and a flu. COVID-19 may attack more than your lungs and respiratory systems. Other parts of our body may also be affected by disease. Now, I want to ask the first panel today, Mr. Aerron ANAK. How are you today,
I'm fine, looking
Mr.
good.
Aerron?
I'm fine. Thank you for
Okay.
asking.
Okay. The question is, how does COVID-19 affect us in our daily life? Can you share with us?
Okay, thank you. That's a wonderful question. Before that, I want to good afternoon to our uh, panel and the moderator, and also people who join us today. So, what how can COVID-19 affect us on social life? From this part, I have two ideas that I want to present to you, which is the first part is in COVID-19 we affect by using technology, which is in our life during this lockup period. During the COVID-19 we happen to have our technology beside us, and we become more reliable and more dependent using them in case we doing some work, in case we doing some homework, or we doing some research that teacher or university literature give us to us. And thus by using technology we able to access some certain knowledge during this COVID-19, other than we go to uh, library to get knowledge, but we can also get knowledge inside the internet by using JSTOR, or we using Google um, library around that time. And also we able to access the technology by using certain online free, which is an online PDF free and online Google Doc. We able to using them. For second part, uh, how this can affect us? This is can affect us by our mental health. By using this certain type of technology for certain time, we able to have some expression, able have to some anxiety, and we able have to some stress. This is all around the COVID-19 period. And thus when we what I can say, when we doing some work and we stress or we happen to hearing some news about the lockdown, this make us some more depressed or anxiety, such as there are such a few back years then we have the extension period of the lockdown. People are rioting and disgusted by the uh, agreement of the government when the extended lockdown period. So I guess the technology and the mental health can affect us during this COVID-19. That's all for me. Thank you.
Thank you for the excellent answer, Mr. Aerron Lee. To all participants, if you have questions for our panels, please add them in the chat box or raise your hand, and we'll be able to answer some of them during the Q&A at the end of webinar. Now, we move to the next panel. Ms. Nadia MYSARAH Binti ZULKARNAIN, Senior Public Health Physician. How are you, Ms. Nadia?
I'm fine. Thank you for asking, Miss Asma.
Okay. My question is, what is the responsibility as a civilian during this pandemic?
Thank you, Miss Asma, for this question. The fight against COVID-19 is a collective responsibility. COVID-19 transmits through human-to-human transmission. As COVID-19 continues to impact societies, it is vital that we maintain our social responsibility to avoid further spreading of the COVID-19 coronavirus, and keeping those who are most vulnerable from getting sick. Here are 8 recommendations from the Ministry of Public Health, the World Health Organization. First, practice social distancing. Always maintain a minimum of 1 meter and ideally 2 meters distance. Second, avoid the 3 C's. Crowded places that makes maintaining social distancing difficult, closed spaces, and physical contact. Avoiding these 3 C's should reduce the risk of contracting and spreading COVID-19. Third, get vaccinated. While vaccination do not provide a complete cure, it reduces the risk of infection. Fourth, stay at home and don't go outside unless necessary. Instead, connect digitally by working from home and reconnecting online with family and friends. Fifth, stay on top of your mental and physical health by keeping your body in shape by exercising and preparing healthy and nutritious food. By keeping our body healthy, it helps prevent or slows diseases. 6. Practice personal hygiene at all times, such as wash your hands. It is the simplest and most effective way to help others because a good hand washing with soap and water kills viruses. We need to wash our hands after touching any surfaces or contact. It is also advisable to avoid touching your face and consume food before washing your hands. Besides that, we need to cover our mouth and nose when coughing or sneezing so the disease won't spread through the air. Moreover, wear a mask when going outside or when you are sick. The mask acts as a barrier not only to protect others but also ourselves. 7. Regularly sanitize surfaces at home. Studies show that COVID-19 can remain for hours or days on surfaces. It is suggested that constant cleaning of surfaces followed by disinfection is a good practice to prevent the spread of COVID-19 in homes and communities. Lastly, Stay informed. Read only reliable sources on COVID-19 updates and do not believe everything you read on the internet. In conclusion, together let's take responsibility against COVID-19 as citizens of our country. That's all from me. Thank you.
Okay, thank you again to our panel for answering my question. It was a pleasure to have you with us. Ladies and gentlemen, here's our special guest, Madam JESSILIANA Carol Anna BIBIEN, as a public health officer. How are you, Madam?
Hi, I'm good, thank you.
Now, I want to ask the last question to Madam JESSILIANA. Transmission to endemic. What does it mean to be COVID-19 endemic? That's my question.
Thank you, Ms. Asma, for the question. Hello, good day, everyone. Before we answer this question, let us briefly review the meaning of epidemic and pandemic and endemic. An epidemic is when the number of cases in a specific geographical area increases unexpectedly. A pandemic is an epidemic that has spread over several countries or continents, usually affecting a large number of people, namely the current COVID-19 pandemic. While endemic refers to the constant presence of a disease or infectious agent in a population within a geographic area. A good example is dengue fever in Malaysia. Since the dengue outbreak in the 1980s, the disease has remained endemic in this country with no sign of complete eradication anytime soon. Here, we can say that we are able to move forward and accept that the world has changed in many ways after 2 years of coping with the pandemic. The community needs to learn to live with the COVID-19 virus in conditions that are least disruptive to daily life by adopting public health measures to protect themselves, their families, and the community. The management of COVID-19 pandemic needs to shift to individual responsibility and community solidarity. It will be a good thing to enter the endemic phase because of the economic and personal satisfaction for individuals. People can travel and perform many activities without tight restriction, and business premises are able to operate until late hours. This help many people who are struggling. This helps many people who are struggling to survive the pandemic, both financially and mentally. As for the healthcare system, entering the endemic phase may mean fewer admission to the wards, which means that hospital can cope better. But do you have to wear a face mask? Do you still need to practice physical distancing? Do you still have to wash and sanitize your hand? Do you still need to take COVID-19 tests? The Ministry of Health Malaysia has relaxed COVID-19 SOP from 1st May 2022, saying that masks are optional when outdoors but encouraged in crowded places, and mandatory when indoors, including public transport and e-hailing rides. Physical distancing is also no longer required but encouraged when not wearing a mask. For MYSARA check-in is also no longer required regardless of vaccination status except those with high risk and under HSO. However, wearing face masks, washing hands and physical distancing are still important to be practiced to prevent further spread of the virus. Also, people are encouraged to take COVID-19 tests before certain activities such as traveling, gathering, or where will you be in contact with others. It is important to note that the freedom that government has granted us should not be taken lightly because everyone must continue to take safety measures in preventing any virus transmission. People should be concerned about the importance of self-discipline and ensure a healthy lifestyle. Now is the time to reflect on ourselves so that we can grasp the immense benefit and blessing that have been offered. That's all from me. Thank you. Back to you, Miss Asma.
Thank you, Madam Jazz, for the explanation. That's a great answer. So we can conclude that even now, Malaysia in an endemic of COVID-19, but it doesn't mean that COVID-19 is ended. So we have to keep wearing masks, physical distancing, wash and sanitize our hands because this is important to make sure we are not infected with the coronavirus. Overall conclusion of our topic today that I can say is COVID-19 is a pandemic that will have a very profound impact on society. COVID-19 will cause various problems and it will not only affect the health of the individual, but it will also affect the economy and politics of the country. Therefore, although COVID-19 have gradually recovered, the people must remain vigilant so that massive spread of COVID-19 will not happen again. Now, I would like to move to a Q&A session. If you have any question, you can ask us. If no question, so I think our group end here. All right, ladies and gentlemen, that's all for allowing us to be here this afternoon and hope this webinar give you a clearer understanding of living with COVID-19. Thank you.
Thank you, ladies and gentlemen, for the informations you have given, you have shared during the webinar. All right, good job. So we're going to proceed with the next presentation. Yeah, see you then. Thank you, everyone.
Thank you, Madam.